Hey everyone, welcome back to my channel. It's Dr. Alessandro. And in this video, we're going to be exploring an interesting statement that we dentists, I believe pretty much universally in this country at least, hear from patients. Can't say daily, but we hear it often enough. And the statement is, "Hey doc, I think I have soft teeth." Well, let me explain something to you all that I have to say there are some genetic conditions. One called, for example, amelogenesis imperfecta, one type of disease, if you want to call it that, which it is. Another is dentinogenesis imperfecta. Those are conditions where tooth structure is not properly formed. And so the teeth tend to chip and break apart. Those are legitimately folks who can say that they have soft teeth. They are genetic conditions. And it's terrible shame. I mean, it's tough, and they have to frequently undergo quite a lot of reconstruction and a lot of dental work. And it's not their fault. It's unfortunately how their bodies came to be. So there are those and possibly other genetic conditions which can contribute to teeth that break down more readily. That said, these genetic conditions are extremely rare. So unless there is really definitive proof that you have one of these, which are very difficult, they're very identifiable too. You probably do not have soft teeth. Okay, so I have to tell you that you don't have soft teeth. Now, some dentists might say that you have soft habits. I'm not going to say that quite directly like that, but you do not have soft teeth. It's a question of other things that are going on with your teeth and perhaps possibly with how you take care of them. So if you're sitting there and you are not brushing well twice a day and you are not flossing reasonably frequently, I'm not even expecting every single day. I'm expecting, maybe 3 or 4 times a week to start. So if you're not doing those things and you're chugging your Mountain Dews, your Gatorades, your Powerades, your sweet teas, your Starbucks frappes with tons of sugar, whatever other things that have a lot of sugar, and you just keep on drinking them all day long or snacking on stuff all day long, you are going to get cavities. It's not a question of having soft teeth. It's a question of bathing your teeth in sugar and acid all day long and not removing that quickly enough, and unfortunately leaving the bacteria to cause cavities. So I'm actually going to demonstrate that teeth are not soft here for you in just a second. I have a couple of extracted teeth that are in, you could say, a reasonably healthy state. And I'm going to show you that teeth indeed are not soft. So hang tight and stick with me. I will show you, demonstrate that teeth are not indeed soft. Okay, so here we have an extracted tooth. It's disinfected, and I'm going to demonstrate that we do not have soft teeth. So, as you can see, I'm kind of nailing it kind of hard, and nothing's happening. Tooth is still intact, root is still intact. So I can wail away at this all day long and nothing's going to happen. Not a soft tooth here. Okay, so as you can see from the demonstration, teeth are indeed hard. They are not soft. You can, kind of bang away at them with instruments and nothing happens. You could even probably, well, we take our drills and we use our drills and we have to push in order to cut through teeth when we're getting to decay. So teeth are not soft, they are hard. In fact, teeth are so hard that they're the hardest tissue in our body. They are harder than bone. And they're what people use in order to identify, for example, bodies that have been, well, say bodies in cold cases where they discover a body that, somebody probably died many, many years or decades earlier. And really the only way to identify them becomes through either medical procedures done or surgical procedures done, and their teeth, because all of us have unique shapes to our teeth, a unique bite, that is how our teeth come together, and unique procedures that have been done to our teeth. Maybe some fillings, maybe some crowns, some braces, some implants, things along those lines. So that said, teeth are hard, and they are the most likely to survive also in accidents or plane crashes or anything along those lines, tragic accidents and things where people lose their lives. So forensic odontologists help with identifying, teeth and bites, and therefore can identify people. So teeth are indeed hard, and they're not soft. And it's not a question of genetics for most people, except for those who, as I mentioned earlier, have a genetic disease which specifically affects how teeth are formed. Now, another important thing. Some people may bring up, well, hey doc, what about identical twins? Do they have identical teeth? And the answer to that is, well, genetically they may, but I've seen it where one twin has perfect teeth, no decay, no cavities, everything looks great, and the other twin instead has cavities everywhere and has all sorts of problems. And again, this isn't because of soft teeth. They're genetically identical people. It was because of what some of my colleagues might say are soft habits. Drinking a lot of soda, eating a lot of sweets, not cleaning the teeth properly. So, that said, by all means, please keep your teeth clean. Brush them twice a day. Floss them regularly, even if it's 3, 4, 5 times a week. And try to avoid this super sticky stuff, and try to avoid your gnarly drinks, as I made the video, your drinking and sipping on sodas all day long. Same thing with sweet teas, with Gatorades, and things like that. Even Diet Peach Snap. And that said, hopefully this helped you to understand that teeth are not soft, they're hard. And I hope you're all staying well and healthy. Thank you for joining me.